Hello everyone. Today we'll be discussing about Dupilumab. So Dupilumab is a fully human anti-interleukin 4 receptor alpha monoclonal antibody which blocks both interleukin 4 and interleukin 13. So it can be remembered by DU means 2. So it is inhibiting two interleukins, that is 4 and 13, and both of them are the significant drivers of type 2 inflammation. So it is a Veloc immune derived monoclonal antibody where the Veloc immune means technology which produces a fully human antibodies for therapeutic use. It uses genetically modified mice with humanized immune system and that create antibodies which can be quickly developed into medicines. Coming to the mechanism of action. So basically IL-13 signals through IL-13 receptors, and IL-13 receptors has two subtypes. One is IL-13 R alpha 1 and IL-13 R alpha 2. So IL-13 alpha 1 binds to IL-13 with very low affinity. But at the same time, when IL-4 receptor, that is IL-4 alpha 1, joins to form a heterodimer, then the IL-13 is bound with a greater affinity. The IL-13 R alpha 2 receptor, it binds to IL-13 although with high affinity, but it lacks a cytoplasmic domain. Thus, it does not signal downstream, but it may act as a negative regulator of IL-13 and IL-4 signaling. While isolated blockade of IL-4 or IL-13 has not been shown to be effective in the treatment of severe asthma, dual blockade of IL-4 and IL-13 has shown promise. Coming to uses, so the one we all know is asthma, then recently approved in GOLD guidelines also, that is COPD, but in refractory exacerbation, then non-small cell lung cancer. So it is being tested in combination with immunotherapy, Semiplimab, in clinical trials for the treatment of early non-small cell lung cancer, but it is still in the trial phase. Then we have atopic dermatitis, and the other FDA-approved indication include prurigo nodularis, eosinophilic esophagitis, allergic contact dermatitis, hand dermatitis, chronic spontaneous urticaria, and alopecia areata. In ABPA, dupilumab may have a role in facilitating disease control with reduction in symptoms and oral corticosteroids use, but there may be a potential for worsening of hypereosinophilia. EGPA, previously known as Church-Strauss, the role of dupilumab is controversial because it has been believed that dupilumab can lead to EGPA. That is how, since it is highly effective in treatment of severe eosinophilic asthma and chronic rhinosinusitis with nasal polyposis, but both of these conditions can precede EGPA. So till the time we don't have biomarkers which can identify the latent EGPA, the clinical course in these patients while giving dupilumab should always be monitored, especially during the phase when you are tapering down the steroids. Then coming down to the trials. So for COPD, the endotype type 2 inflammation, the landmark trials are NOTUS and BOREAS trial. And in both the trials, annualized rate of moderate or severe exacerbation was significantly reduced. There was improvement in the lung function, mainly in pre-bronchodilator FEV1, both at 12 and 52 weeks. For asthma, the named trials are Liberty Asthma Quest, Liberty Asthma Venture, Rapid Global Registry. All three show that the dupilumab reduces the risk of severe asthma exacerbation, improves FEV1 and the quality of life in patients with uncontrolled moderate to severe asthma. Then coming to the dosage. So for asthma, uh, it, it is being given subcutaneously. There are two doses. One is 400 mg followed by 200 mg every other week. The other dosage is 600 mg given once and then it is followed by 300 mg every other week. The second dosage is preferably given in severe asthma patients or the patients who are having steroid dependent asthma, oral steroid dependent asthma. And minimum 4 months of dupilumab should be given at least to check whether it is efficacious or not. In COPD, the dose given is 300 mg once every other week. Coming to the ADR, the adverse drug reaction most commonly noticed are nasopharyngitis, headache. While giving it for the treatment of atopic dermatitis, the most common noticed as per the literature is head and neck dermatitis, conjunctivitis, erythema, pruritus, peeling of skin, and dryness of eye. But there is a big list, uh, including all the literature available till now for dupilumab. So, where we have dermatological drug reaction, infections, GIT side effects, eye side effects, few nervous system like headache, dizziness, musculoskeletal, and respiratory. Drug to drug interaction. So, patient on warfarin may require monitoring of ETINR and dose adjustment accordingly. Increased concentration of certain cytokines like IL-4 and IL-13, which we are discussing here, can alter the function of CYP450 enzymes. Otherwise, as such, there is no significant drug to drug interaction which has been observed as per the latest FDA label. Only interaction which was significant was between metoprolol and dupilumab, because there was an increase in the area under curve of 29%. Also, dupilumab is not advisable to give along with the live vaccines. Contraindication of dupilumab. So, hypersensitivity to any of its component. If angioedema has been reported, patient having a hypersensitivity to hamster protein, and if the patient develops hypersensitivity reaction like severe rash or allergic conjunctivitis after the administration of dupilumab. So that's all about dupilumab. Have a nice day. If you like the content of the presentation, do like the video and subscribe the channel. Thank you.